Good afternoon, and thanks for joining us for today's Healthline. I'm Shannon Brinius. On Healthline, we enjoy focusing on ways that you can live a healthier, happier, and pain-free life. And so we're going to be taking your calls and answering your questions live here in our studios today. And we'll be opening the phone lines in a few minutes. But as a reminder, when you make a call, please make sure you're in a quiet room so you call in with your TV turned all the way down. That'll help prevent any of the feedback that can interfere with the audio. Our number is 318-219-4569. Again, those phone lines will be opening in 5 minutes. And today's topic is heart health and how to stay heart healthy. And our guest today is Dr. Syed Mahmood with Red River Cardiac Surgeons. Thank you for joining us today.
Thank you for having me.
So we are going to be talking about all the things that have to do with making sure that we're all heart healthy. But why don't you tell us a little bit about yourself and your practice? How long have you been a doctor of cardiac surgery?
Well, my name is Syed Mahmood. I'm a cardiothoracic surgeon. Our group is called Red River Cardiovascular Surgeons. I've been in Louisiana for 14 years, and I have been a practicing cardiac surgeon since 2009.
And tell us about your group. What makes it special?
There are 4 cardiac surgeons and soon to be 5. We just recruited a 5th member, Dr. Mehmood, who specializes in robotic mitral surgery. She's going to be joining our practice in July. We are dedicated to providing the best care we possibly can. Some of the care that's only available in big cities like Houston or Dallas, right here in Shreveport.
That's great. And one of those specialties, one of those practices is something called, and I'm going to read off here, cardiogenic shock.
Yes.
What is that?
Cardiogenic shock is either you have a big heart attack or a virus can really make your heart muscles weak, and when that happens, time is of the essence. We started me and Dr. Prejan, who are both part of Red River Cardiovascular Surgeons, we started the ECMO program here almost 11 years ago, and since then, it's become a multidisciplinary approach, and we have a shock program, and we're trying to even make it better as we speak. So when you have a major heart attack, time is of the essence, and you need offloading, and you need your heart and muscles to relax, and that's what a cardiogenic shock program is. It is the time from the time you get sick to come to the hospital to time when we can support your heart so your organs don't start collapsing.
You mentioned ECMO, and I've seen or heard ECMO used on a lot of these, health programs, the dramas like Grey's Anatomy and such. So what is ECMO and how does it work?
ECMO is an extracorporeal membrane oxygenation. That means it's pretty much a heart-lung machine. So it bypasses, if your heart is not doing well and when your lungs are not doing well, it can bypass everything and still support your organs. When you go into cardiogenic shock or any kind of shock, the blood is not getting to your organs enough, and you can go into what we call multidisciplinary organ failure. So your kidney starts failing, then your liver, then your brain, then your heart. So to support all that, we can put you on this machine, which is the ECMO machine, which can bypass all of these things. So it's my preferred modality when you're really sick. I really think that is what will give your heart or lungs time to catch up. When COVID happened, we helped a lot of people with that ECMO circuit. You really didn't need it for the heart, but you didn't need it for the lungs, and we had something that we could keep people alive for 40, 50 days till we could get them off ECMO if the lung recovered, and if it didn't recover, we had ways to get them to places that could do a lung transplant.
I was wondering about the time that is used on that. You're saying 40 or 50 days. So
for the lungs? For
the lungs.
For usually hearts is usually a week to 2 weeks. It's shorter.
Okay, and people are lying immobile. Are they conscious or unconscious in this process?
They're, when they first come, when they're very sick, they're totally immobile. They have a breathing tube down there. They're on multiple pressors, but especially with ECMO for the lungs, we were able to get the breathing tube out, so they were talking. They couldn't really walk, but they were at least, we could get them up in a bed, in a chair position, and they could talk to us. There's on ECMO, if we thought it was going to be long term, then we could actually put them on a different cannula in which they could actually walk a little bit in the room too. So.
Okay, so learning a lot about these different therapies. One of the therapies that you utilize at your practice is called Baristim therapy, and that's being used for advanced heart failure. So what is it and how does it work? How does it help?
So we talked about ECMO and our shock program, which is acute. But some people, if the muscle in the heart's already been damaged, or they had a virus that damage the muscle, they get this chronic heart failure, in which just during your daily activity, like walking to the mailbox, you get short of breath, or you have no activity, like you were a big hunter, or you enjoyed mowing your lawn, or doing whatever activities you enjoyed, you can't do that. So Baristim was FDA approved approximately 3 years ago, and I think we are probably the highest implanter in Louisiana. We've probably done over 60 of those, and really helps the people. Me as a physician, I really enjoy when people tell me, I'm a surgeon, I like to fix things, and whatever I do, if it makes a big difference in your life, that's what gets me pleasure, and that's what Baristim does for a lot of people. So it's a 45-minute outpatient implant, meaning that's how long it takes me to do the surgery. You're here for 2-3 hours. I do it. You go home, and it takes 2 or 3 weeks, but 90% of people start feeling better. With heart failure, what happens is you keep getting hospitalized again and again and again because your heart is failing, readjusting your medication. With Baristim, the amount of hospitalizations is cut by more than 50%. You have a better quality of life. I'll tell you an anecdotal story. My first one I did was on this guy who lived out in the middle of nowhere on a farm, and his biggest activity was just blitzing around the farm and cutting his grass and taking care of his cows. And the wife complained when she came to me, he wouldn't listen. He's out doing all those things that he hasn't done for 5 years. I told her, that's the whole point of this. I want him to do the things that he used to enjoy that he can't do. So it does make a difference, and these guys are usually very grateful.
So she shouldn't expect to see him lounging by the TV. She should expect to see someone a little bit more active. Does it work like a pacemaker in a way?
It does. It's a pacemaker that you implant right on the carotid, which is what supplies blood to your brain, and it signals your brain to tell it you're not that sick. The heart failure, the cycle starts with the heart starts dilating, and when it starts dilating, you retain more fluid, and then it goes into this vicious cycle. It prevents that from happening. So it kind of tricks the brain, saying your heart is not that sick, you're okay, and stop doing these things that are actually harmful for you in the long term.
Does it stave off, say, needing a heart transplant or something to that extreme?
Yes, for sure. Right now, there are a couple of studies going on, but I'll tell you, again, anecdotal, a couple of heart failure cardiologists I know say we don't even send them for heart transplants till they fail Baristim therapy.
So first they do that.
Yes.
And then they'll consider if that doesn't work.
Yes. For heart failure, for transplants, let's say 5,000 people need transplants. We only have 1,500 hearts to give. So whatever we can do to prolong it is better for the patient, and some people don't even need it. It works miracles.
Interesting. Okay, so we learned something new today, Baristim therapy. So that's something that definitely that you might want to contact or reach out to Dr. Mehmood and the people at his surgical practice. Again, we are taking your calls live in our studios. The number is 318-219-4569. Taking a look at the clock. The phone lines are open, so if you have a question about heart health, you might want to give a call because we can answer them right here. So now let's talk about another type of surgery that might be for valve repair. I understand that there's something called a MitraClip or a TriClip. What are those and how are those used when dealing with valve replacements, I guess, or repair?
So, again, I'm a heart surgeon, and one of our bread and butter cases is there are 4 valves in your heart, and the 2 most common valves that go bad is the aortic valve, and then there's a mitral valve. The mitral valve sits very posterior, it's underneath the heart. It's hard to expose, and the tricuspid sits on top, but usually we don't do much for tricuspid. It causes heart failure, but usually most people can tolerate it. Even currently, mitral valve surgery is the first approach, but if you're, let's say, 90 years old or 80 years old and you've had 2 heart surgeries before, then mitral valve open heart surgery is prohibitively risky, or when you're 90s, everything is prohibitively risky. In those patients, we can go in with the groin, and maybe in 2 hours we can deploy this clip that maybe 50 to 80% of the people can get, that can get you good enough. It's not perfect like open surgery, but it's good enough that we can improve your quality of life. TriClip was just approved 6 months ago. We did our first one a few weeks ago, and we actually supposed to do our second one tomorrow. It's some therapy that was only available in Houston and Dallas that we are bringing into our city. It's the same concept. It's again for people that cannot undergo open surgery for one reason or another, and then we can do things that can make their quality of life better.
That's wonderful, especially I have a relative who underwent open heart surgery maybe when it was too late. Maybe it would have been beneficial to obtain one of these, and so that's always encouraging when you can keep it to essentially what's a non-invasive surgical approach.
Yeah, for sure.
Right.
And then these TriClips, MitraClips, most people go home the next day.
Wow. That's great. That's great. So the recovery time is good. So differences in those, it sounds like, is one is a little bit more advanced, the TriClip. Is that what my understanding is?
Advanced, it's TriClip it just came out. It was much harder to fix than the MitraClip, which was easier, which we've had for almost 10 years. So yeah, it just came out. But again, both of those therapies, MitraClip still in this current iteration doesn't, it fixes some of it, but doesn't fix all of it. Open surgery fixes almost everything 100%. MitraClips maybe most of the time makes it better, but not completely better. There's a lot of technologies that are currently in development that are not FDA approved, that I'm hoping next year or two will come out from prime time, but I've been saying that for 5 years. It's almost there, but they're still having issues.
Still need to study it, still
Yes.
need further study and further research. Okay, we're talking now, as we move from hearts to veins, about venous disease. It increasingly is something that's coming up. So what sort of rescues and approaches can you use with people who need help with their veins?
We have a multidisciplinary vein clinic right here in Shreveport, Willis Knighton Vein Center, in which we treat everything from pulmonary embolisms to varicose veins, spider veins. We do all three things. My primary input to this is, again, the things that need fixing. So if we have you throw a blood clot from your veins to your heart, I can go in, I can either suck it out, or I can put these catheters in there that can dissolve it. The other options is, especially in women who have had a couple of babies, your veins stretch, and when they stretch, the valves don't work, and you get these varicosities throughout. If you're not careful, over time, either they'll start bleeding, or you start getting these patches on the middle part of your legs called alligator skin that gets hard and calcifies, and you start getting wounds. Venostasis ulcers, those are horrible. So the whole point of those vein surgeries is to prevent the venostasis ulcers from happening, also to decrease the pain from those, and we can fix it. For varicose veins, what we do is we strip them, and for the main veins that are causing this backup, that causes this varicosity, so the venous changes, we can burn them through a laser. Again, minimally invasive procedure. You come in, usually takes me 45 minutes to do it, and you go home the same day. And I've done it on people who went to work the same day.
Wow. Is this done under general anesthesia or just localized?
You can do both, but I prefer general. I don't like to feel pain. I don't like to inflict pain, so I try my best.
Okay.
It's a very quick, it's not completely general. It's an LMA, which is like a fake general.
And so for people who might be out there thinking, well, varicose veins are just cosmetic issues and don't really need to deal with them, you're saying there can be complications later on if people don't take care of them.
For sure. If you start seeing, it usually looks like you have worms underneath your skin, or veins popping out, and especially if they're getting worse, or you think something is almost purple underneath your skin, is popping out, that can cause a bleed and people can die from it. Or when you get venostasis ulcers, that is miserable. So if you come to us soon enough, we can prevent both of those things from happening.
Are you seeing more clots being thrown because of, in the aftermath of COVID, when so many people got it, maybe got treated for it, recovered from it, but maybe had more clotting issues than before?
I think when everybody was getting COVID and you were getting actively vaccinated, there was a high incidence, but I have been, in the last few years, it's back to normal.
It's back to normal. So how many cases would you say you treat in, say, a year?
Our number is around 55 to 60.
Okay.
I used to treat all of them a few years ago, but now I got partners and a lot of help, so 11 on average right
That's
now.
good, that's good. You need the help. It sounds like you've got a very busy practice. Why go with a multidisciplinary model like it sounds like you have at Red River Cardiovascular Surgeons?
So, I think, all of us, and when we do multidisciplinary in my field, is the cardiologists, the intensivists, the heart surgeons, the imaging cardiologists. I'll give you an example for the shock program. All four people come together and say, what can we do to manage it? All of us are specialized in different things. Like, I'm a surgeon, so I see a nail, I want to hammer it. But sometimes the best thing is, ignore the nail or make a cut somewhere else. And everybody comes together and says, what can we do? And especially in today's day and age, it's just because I can offer it, it's not the right thing for the patient. And we can change it so it can be offered by somebody else in a more invasive way. And also, as a surgeon, there's only one surgeon, but there are 4 intensivists who are on 24/7. With having enough help, it's actually better for the patient because things get caught up sooner. So I see them, interventional cardiologist see them, the imaging cardiologist sees them, and the intensivist sees them. So there are 4 different people keeping an eye on the same thing, so less things get missed.
So this would be, does someone come to your practice, or is this something where you're engaged through the hospital system?
For both, I'm very specialized. For most people who come to me are referred to me by a cardiologist, or in some instances by the primary care. Like venous disease is usually by the primary care, but most heart surgery, you have to see a cardiologist. I need heart cath, the valves looked at, and then we usually have a meeting every Friday where all of us sit together and we say what's the best way to fix it. All surgeons, all cardiologists.
It sounds like this can be something that really saves lives.
Oh,
I
for
mean,
sure.
When you look at it, when you have that multidisciplinary approach.
Yes, I think so. Sometimes I have blinders on, sometimes interventional cardiologists can have blinders on. With the multidisciplinary approach, it just provides better care, saves lives, sometimes quicker, less invasive care. So.
And everybody likes the less invasive care because it's less recovery time, right? And
it's better for the patient. As long as we can justify it's not inferior and improves your quality of life, I'm all about less
great.
invasive.
And Louisianans they benefit specifically from a lot of the programs that are offered through your practice, correct?
For sure, ma'am. I think Louisiana, unfortunately, has a lot of diabetes, a lot of morbidly obese, meaning bigger people, a lot of smoking, not a lot of exercise.
A lot of rich food that we love.
Oh, I love it too. But all that stuff can clog up your arteries. And I think Louisiana or Mississippi, we have one of the highest cardiovascular disease states, and we just are here to help people live a normal life.
How successful are you when someone comes in, is referred to you, and you are advising perhaps surgery, perhaps open heart surgery, or perhaps something that's less invasive, but then they also need to make lifestyle changes? How successful is that?
A lot of times, I'll give you the example of guys, their wives get into the mix and they try their best to make sure. But people are people, and especially some people are very stubborn. I would say 60% of them make a big difference. And you can tell the ones that actually listen to us will live longer. I'll give you an example. God gave you arteries, or God gave you valves. Anything I do will never be as good as that. So if you don't take care of the stuff I'm giving you or fixing for you, it'll break much faster. It won't take 60 years, 10 years, it'll break. And especially if you, peripheral vascular disease, if you continue smoking, it's going to break. But smoking is one of the hardest things to quit. And changing your lifestyle, you are who you are, and you've been doing something same way for 60 years, hard to modify, but some people do. It is, especially open heart surgery, it is life altering. It's a big traumatic event, and people can use that to make their lifestyle better. And I do see it happening, 60%, I would say.
You mentioned smoking being one of the biggest risk factors for cardiovascular disease. What about vaping? Does vaping fit into that same mold, or do you see less, or is it too soon to tell with vaping?
I think when it comes to heart disease per se, it's the nicotine in there. So chewing tobacco, nicotine gums, vaping, all them will cause heart disease. I'm hoping, and again, vaping just started a few years ago. In the next 10, 20 years, as we get data, maybe with vaping you'll have less chance of lung cancer, but it's still causing the heart disease because it's mostly nicotine mediated.
Right, nicotine-based,
Yes.
Of the liquid or the vape, the vapor in there. So walk me through what happens if someone's referred to your practice. What do you do?
First thing we do is see why you referred to us. We sit with you. My job as a surgeon is to give you risks and benefits. I tell you, okay, this is what I can offer. These are the alternatives that I cannot offer where they're available, and these are the risks for the procedure. A lot of times, a lot of things I do. Let's give you an example for open heart surgery. The coronary artery disease, if I don't fix this, has a very high mortality. If I do open heart surgery and you really have triple vessel disease, you need open heart surgery, your survival is much better at 5 years with open heart surgery. And if you do PCI, medicine has the least survival. PCI has good survival, 2 years, and then surgery starts getting better because my grafts don't close as much, and one of my memories stays open much longer. So I give them all the information. 90% of people choose me. 10% say I don't want anything, or I want PCI, and I say, it's just my job to tell them what to do. So when you refer to us, we'll sit with you, we'll spend as long as it's needed to talk with you and your family. And if you're not convinced, I've been doing this for 20 years now, I can tell when you're hesitant or you're worried. I said, okay, we're going to schedule your surgery in a month. You come talk to me once more, maybe a couple of days before, or even as many times you want. We can do it over and over again. I'll give you another example. Whenever I'm telling you about an open heart surgery, especially if you're in the hospital or clinic, you really don't know what it entails. A lot of people, I'm saying the same thing over and over again, and I understand. When you are faced with a difficult choice that having your heart split open, chest split open, heart exposed, it's traumatic and you don't think right. So I want you to know, and I also tell the family members, God forbid if a complication happens, it'll happen to your father, mother, or this person that I'm operating on. So it's their decision. The last thing you want family is saying, you force them to do it and there's a problem, then you blame you. No, it has to be the patient's decision which way they want to go.
Do you see pediatric patients as well? I mean,
no. 18 years is my cutoff.
So 18 years and young, or 17 and younger, they would go see a pediatric cardiologist.
But pediatric cardiologists, we don't have any pediatric surgeons in Shreveport.
So that means traveling. Yeah. So we should feel very fortunate that you and your practice are here. It sounds like to have all these specialties in this multidisciplinary practice here that people can tap into. And I'm surprised we haven't had any phone calls because the phone line is open and you can have a question for Dr. Mehmood. And again, the number is 318-219-4569. Give us a call. Just make sure you're in a quiet place and you can ask your questions. So you're located, tell us your location and what your phone number is and how people can reach your practice.
Sure. We are located in Greenwood Road, right by Willis Knighton North. Our number is 318-227-9777. We are available 24/7. Either you'll get one of my office staff or you'll get a surgeon through our answering service. Just one phone call, either you or your primary care or your cardiologist can make a referral, and we'll be glad to see. And if you want to just come see us, you can just call us and we'll see you.
And so after someone has had a procedure done, is there follow-up physical therapy that they need to be doing? Do you prescribe, walking or, any sort of physical activity?
Oh, for sure. Most procedures, again, different kinds, different things, like open heart surgery, you do get physical therapy. We'll see you for the first few weeks, make sure you're okay, let the bone heal a little bit, and then usually we'll refer you to our cardiac rehab center that specializes in it. So they make sure we make sure you slowly ramp up your activity and get you back to doing all the things that you enjoyed doing.
I believe we have a caller on the line. Lucia is your name? Go ahead.
This is Susan.
Oh, Susan, sorry. Go ahead, Susan.
I just wanted to, it's not a question, I just want to thank Dr. Mehmood for doing my open heart surgery almost 5 years ago, June 2nd, 2021. I had an aortic valve replacement, and he did my surgery, and it turned out great, and I'm living a wonderful life, getting to take care of my grandchildren, and I can't thank him enough.
Thank you, Susan. I appreciate it, and it warms my heart to know that I make a difference in you and your life as well as your grandchildren's life. That's why I do what I do.
You definitely did.
Thank you.
Thank you so much.
Oh, that almost brings a tear to your eye. You've given her a new lease on life and an ability to enjoy your grandchildren for many years to come. So that's exactly the goal, right?
Yes, ma'am. Make people feel better.
Yeah.
Get them doing the things they enjoy the most.
So in this case, it's not that you want a patient for life, because you're hoping that you never have to treat Susan again, right? One and done.
Well, if I'm always here if she needs me, and she can tell you I said the same thing. Just come. Hopefully you'll never need my services again, but if you do, I'm always here.
Okay, that's wonderful. Again, we want to let people know we're probably out of time for phone calls right now, but thank you to Susan, who gave us a call to talk about her valve replacement and how it worked out wonderfully for her, and she had great glowing things to say about you and your practice. And again, if you would like to find out more about their practice, they're located at 2751 Albert Bicknell Drive, and like you said, located right near Willis Knighton North. So that makes it very easy. The number to call, 318-227-9777. In our final minutes here, Dr. Syed Mahmood, what would you like to say to the audience when it comes to protecting their heart, being good to their heart, and what to do if problems arise?
I think the first thing you have to do is make sure you go see a physician, especially when you turn over 40. Saying that I've never seen a physician when I'm 60 and nothing was broken till I saw it. No, you had things broken. The body was compensating till it got too late. So see a physician. If you're smoking, try to quit smoking. Try to have as healthy lifestyle, eating well. You can have your cheat days, but most days eat well. Your body's like a temple. What you put in it is what you're going to get out of it. And especially as you get older, exercise is important. Healthy lifestyle, healthy eating habits are important. If you're diabetic, make sure you do the things that keeps your sugar low. All those things are important, and the most important thing is quit smoking.
Yeah. Okay. There you have it. And they call cardiologists the rock stars of the operating room. Do you feel like a rock star when you're in there?
I try to be humble, and we just try to do our best for each and every one we can.
It had to be, though, a calling that you felt when you chose that particular specialty.
It was.
Yeah.
All of us have convoluted ways of getting into it, but I have no regrets. I've really enjoyed what I do.
Because the heart is a magnificent thing.
It is, and you make a difference. And a lot of things you do, I used to get bored in other stuff. I never get bored in this. So.
There's always a new challenge around the
Always new, and everybody's just a little different.
Okay, and as you said, a lot of potential new therapies that might be new tools and
a lot of exciting stuff coming.
But hopefully it's getting researched and right around the corner.
A lot of money, a lot of time is being poured into it, and as soon as it's approved, we try to get it over here. So.
Okay. Do you ever do research in your practice?
Oh, for sure. Like in Baristims, we are starting one of the trials by the company soon.
Interesting.
Yeah.
Okay, so again, that is a therapy that could be used, a tool
for heart failure.
For heart failure that could be used that might stave off the need for a heart transplant, and definitely something that someone might really desire.
Oh, for sure.
Yeah.
And there are some new avenues coming. We're going to be implanting in people who are not as sick, see if we can stave off the vicious cycle sooner.
Interesting.
Yeah.
Okay, well, Dr. Syed Mahmood of the Red River Cardiovascular Surgeons, thank you for joining us today. We appreciate it.
Appreciate your time. Thank you for talking to me.
All right, and we hope you've enjoyed this Healthline 3. Have a great day and stay healthy.